Did you know that every 40 seconds someone in the United States has a stroke, and about every 3 minutes someone dies of a stroke? It's something that's preventable and treatable. Today I'm joined by Dr. Andrew Ringer, a neurosurgeon at Mayfield Brain and Spine, to discuss this topic further. This is National Stroke Month, and it's so great to see you, Dr. Ringer. Thanks for being here.
Thank you, Michelle. It's a pleasure to be here.
Now, we know that time is crucial if someone is having a stroke, and I know about this because my mother had a stroke. I was talking to her, and she started to slur her words, and I thought, oh my gosh, we better get on this. So what are some of the symptoms, the warning signs that people should know about?
Well, you pointed out one of them right away, and that is the speech. When someone's speech is unclear, or if their words are coming out like gibberish, almost, I like to say it's like they're speaking Greek, but they don't know how to speak Greek.
Right.
We like to use as an acronym, as a guide to pick up symptoms of early stroke, something called B FAST. That stands for B for balance. Check to see if the patient's able to stand steadily. Eyes, are they missing vision to one side or the other, or are their eyes pushed off to one side or the other? Look at their face. Does it appear that one side is drooping? Is it asymmetric? Check, have them hold up their arms. Check their arm strength. Is one arm drifting or falling down? Ask them to speak. Does it sound slurred, as you pointed out?
Right.
And then if any of those things are positive, then it's time to call 911.
Yeah, and all she had was the speech, but I said, we've got to get on this right away, and it was a good thing we did. So who is more likely to have a stroke? I know we tend to think it's older people, but not necessarily, right?
Well, there are a number of risk factors for stroke, and some of them are what we call modifiable risk factors. These are the things that we can control. So, for example, smoking, as you can imagine, is a really big one. That is a significant increase for heart disease and for stroke.
Yeah.
Having uncontrolled high blood pressure is also a risk factor. People who have high cholesterol, in particular the bad cholesterol or LDL cholesterol is another one. But these are things that we can modify and treat to try to eliminate or reduce that risk. There's another one that you would have to see your doctor about to recognize, and that's an abnormal rhythm in your heart that we call atrial fibrillation, or AFib. And this is an abnormal movement in the wall of the heart that allows blood clots to form that could potentially break off and cause a stroke. But all of these are potentially treatable if you work with your doctor to treat them.
Yeah, and I noticed, and I don't know whether it's scientific or not, but it seems like younger people are having strokes.
It always seems like things are happening to younger people as we stop being so young. But
wait a minute, okay.
So that's what I've recognized in my practice anyway. Yeah. But you're right, and part of that is because some of these risk factors are not necessarily age-related. So you can have abnormalities of heart rhythm or blood pressure or things of that nature at virtually any adult age. The youngest stroke patient I've treated was 13 years of age. He made a great recovery and fortunately threw out the first pitch at the Reds game for Strike Back at Stroke month, or their event. Yeah. But it can happen, it does happen more frequently as we age a little bit.
Yeah.
But these risk factors can appear at almost any time.
Tell us about treatments available now. Anything new?
There are. So it's amazing what has changed in the treatment of stroke just in the time of my career. When I first started, there was virtually nothing available. And then one of the first national studies, which actually was headquartered here in Cincinnati, proved that the drug TPA could dissolve blood clots and help open the blood vessels to return blood flow and reverse a stroke. That turned out to be great, but mostly for smaller strokes, and it wasn't until 2015 that we developed invasive procedures to actually go inside the patient's body, identify the blood clot that is occluding the blood flow to the brain, get a hold of it, and take it out. We call that a mechanical thrombectomy. Just taking the blood clot out is what that means, and it works tremendously well if we can get to the patient in time.
Yeah, we often hear about taking aspirin.
Yes. So the aspirin has a lot of benefit in patients who have risk factors. Now, we've been back and forth on the science for aspirin a little bit because it is a blood thinner.
Yeah.
As a result, it does mean bleeding is a little more common.
Yeah.
And the question is, what's worse, the blood clotting or the bleeding? And it turns out if you have some of these risk factors, or you've had previous mini strokes or chest pain like a heart attack, aspirin is clearly beneficial in those patients.
Yeah, I guess it would depend on the patient.
That's correct. If you've not had any of those problems, then maybe it's not worth the risk.
If people have questions, where should they go, doctor?
Go to your family doctor. A lot of this information is available through guidelines that are published through the American Heart Association. They're very on top of things.
And I'm sure we can go to Mayfield as well.
Absolutely. Mayfield is working very hard to make sure that stroke care is available throughout the community. In particular, those emergency procedures we talked about, as you can imagine, we have to be there with each other
Right.
in order to administer that. I can't administer a medication or do a procedure over the phone. So we're working very hard with all of our healthcare partners throughout the region and throughout the city to try to bring interventional stroke centers to the various different areas where people live. Over the years, we've developed a comprehensive center, Good Samaritan Hospital downtown. That's the highest level of certification available. We worked on the north side with Jewish and Bethesda North, and this summer we're hoping to start doing stroke treatments at St. Elizabeth, trying to get those emergency services available throughout the community where it's needed.
Okay, Dr. Ringer, thanks so much for joining us. We really appreciate it.
It's my pleasure. Thanks
All
for
right.
having me.
Uh-huh.